Hello everyone, my name is Raekwon Williams and this is my video for this week's module on engagement and assessment within our agency. So as I've stated, I am currently placed at the Shepherd Center, this semester has been a lot different as far as my overall interaction and engagement within the entire case management process. The role is pretty much the same as far as me following a group of medical case managers and learning the process from admissions to discharge. But I have a little more hands-on experience with having a client of my own and gaining more of that type of exposure. So the Shepherd Center is a hospital that's concerned with individuals who have experienced or have any kind of brain injury or dysfunction or a spinal cord injury. And we pretty much work from admissions to discharge with that process. So in regards to engagement within the overall process here at the Shepherd Center for Case Management, a lot of that comes from is related to engagement with families directly, and as well as like engagement with your colleagues and your medical team. So Shepherd Center is a very big network of professionals who all play a certain critical role to the overall care that a patient will receive once they are admitted to the Shepherd Center. So there's the occupational therapist, the physical therapist, the neuropsychologist, the nurse practitioner, the clergy, as well as of course, the doctor, and then case management. So a lot of engagement has to deal with getting all the pieces to the puzzle from the family and from the patient directly, as well as getting the pieces from your medical team and putting that together, as I said, to give the best care for that patient, and so that their discharge planning will be the most optimal for their improvement overall. And as far as assessment here is not really done as you would typically think, as far as like a psychological assessment. A lot of the stuff like that is done by the other medical team members. Case management really just is the glue that sticks everything together. So assessment has to do with contacting the family, meeting the patient to see where their recovery, how well they're recovering during that time at Shepherd. Being able to reach out to insurance companies to be able to relay that type of progress and all of the information. Some patients don't have insurance, so being able to think outside the box and see other alternate options such as Medicaid, Medicare, financial assistance programs that Shepherd offers, and ultimately making sure that once the patient discharges from the Shepherd Center, that they have a support system that will be able to continue to support their recovery. And that's, of course, contingent upon what kind of injury they actually have. If it's maybe a temporary thing or maybe a lifelong injury that they will just kind of have to adapt to their everyday life. So that includes, Shepherd has a couple of extra programs for recovery based on a brain or spinal cord injury. And then there's patients that come from all over the world. Like we have a patient that's here from Jordan in Africa right now, which is a whole different type of thing. So seeing maybe if that patient would be right for continuing therapy in Atlanta, or maybe continuing therapy within their own hometown. Do they have the family support at home? All of those factors are a part of the assessment that goes into case management here at the Shepherd Center. So I have really enjoyed my time here so far, and I really just hope to gain more experience as I continue to advance and finish the rest of the semester out.